Hello, everyone, and welcome to the Autoimmune Dietitian YouTube channel. My name is Annie. I'm a registered dietitian, and I work with people struggling with autoimmune diseases. In my work with my clients, I help them use both food and lifestyle as a way to improve their symptoms and hopefully give them their lives back. Today, we are talking about vitamin D. And if you've been following me for a while, you know how obsessed I am about vitamin D. I think it's one of the things that everyone should be paying attention to, especially when you live with an autoimmune disease. So today, we're going to talk about what vitamin D is, how it's connected to autoimmune diseases, and what you can do to increase your levels. So before I begin, I just need to attach a disclaimer to this video that the information in today's talk is not the substitute for the diagnosis, treatment, or care of disease by a medical provider. This is for informational purposes only. So please consult your qualified health professional for any changes you make to your medical care. So what is vitamin D? Vitamin D is a fat-soluble vitamin that we mainly get from the sun, which is why it's known as the sunshine vitamin. When sunlight hits our skin, the UVB rays are absorbed by a cholesterol compound living underneath the top layer of our skin, and that is called 7-dehydrocholesterol. The absorption of the UVB rays convert this compound to precalciferol, or pre-vitamin D3. The heat from our body then transforms pre-vitamin D3 into vitamin D3. At this point, the D3 travels to your liver where it's converted to 25-OH vitamin D3, which is a major circulating form of the vitamin. And then it's transported to the kidney for its final conversion into the biologically active form of D3, which is called 1,25-OH2 D3. That is a mouthful. So the vitamin D that we get from food actually undergoes the same conversions after it's absorbed through the lining of our small intestine. It travels to the liver and then the kidneys in the same manner. So despite vitamin D being called a vitamin, it actually functions more like a hormone in the body. Hormones are regulators of many different bodily processes, and I like to think of them as traffic lights in the body, directing processes from start to stop. Vitamin D helps manage bone maintenance and repair. It controls both calcium and phosphate levels in the blood. It contributes to the development of the nervous system and cell growth. It's also important for heart health and plays a role in reducing inflammation. Vitamin D also plays a really important role in our immune system function. Anytime you have inflammation, there are chemicals that are released to increase inflammation, and this is how your body essentially protects itself and heals. And vitamin D helps to reduce these pro-inflammatory chemicals that are released during an inflammatory or immune response. It also reduces the creation of inflammatory T cells that contribute to chronic inflammation. Vitamin D helps regulate tight junctions in our intestinal barrier to prevent leaky gut, which is a very common theme among a lot of autoimmune disease people or people that have it. Vitamin D is also a general marker for health. Low levels of circulating vitamin D in our blood increases the risk of developing cardiovascular disease, neuromuscular disorders, autoimmune diseases, and cancer. So how does vitamin D influence autoimmune diseases? So the role of vitamin D in our immune system is important to keep in mind when we're thinking about autoimmune conditions. In fact, several research studies on different autoimmune diseases show a connection between vitamin D status and the disease onset and progression. So I'm going to quickly run through a few of these autoimmune diseases and the research connecting low vitamin D levels and disease onset and progression. So there was a study done on rheumatoid arthritis and vitamin D, and they found that low levels of vitamin D may contribute to neuropathic pain, which is like shooting or burning pain. Increasing vitamin D levels actually helped alleviate pain in these people, and supplementation may improve symptoms and inflammatory markers for people with RA. In terms of lupus, individuals with lupus tend to have lower circulating vitamin D levels. Lower D levels were associated with an increased disease activity and higher risks of fatigue, cardiovascular disease, and cognitive decline, and more severe flares. And supplementation was strongly recommended for this population. Type 1 diabetes. Vitamin D may have a protective role against the onset of type 1 diabetes. The lack of supplementation in childhood and low maternal D stores increase your risk of developing type 1 diabetes. And individuals with this autoimmune disease also tend to have low D levels, and low levels may contribute to worse glycemic control in some studies, but other studies refute this. So that one isn't necessarily as clear as we think. And then in terms of thyroid, so in both Hashimoto's and Graves', vitamin D suppresses inflammatory cytokines, or it can increase anti-inflammatory cytokine production. So several studies note a higher risk of Hashimoto's thyroiditis with low vitamin D levels. With Graves' disease, women in remission had higher D levels. Low levels of D doubles the risk of developing Graves' disease, and vitamin D supplementation may be beneficial for this population as well. And then lastly, multiple sclerosis. So prevalence of disease increases as latitude increases, suggesting that sunshine exposure and vitamin D levels are associated with an increased risk of developing MS. Studies show that most MS patients have low vitamin D levels, and one study even indicated low vitamin D levels during relapses and higher levels during remission. So generally speaking, to summarize all of that, individuals who have been diagnosed with an autoimmune disease tend to have lower vitamin D levels. In some autoimmune diseases, such as rheumatoid arthritis, lupus, Hashimoto's, Graves', and multiple sclerosis, those with lower levels of vitamin D demonstrated an increased intensity of symptoms and disease activity. And in some cases, individuals in remission had higher vitamin D levels than those who were experiencing flares. So important to note here that when you are tracking your vitamin D levels, there's a pretty wide range of acceptability. And a lot of times I see people, who get their vitamin D levels checked and they're like, well, my doctor said I'm fine because it's in the normal range. The normal range is pretty big. So for optimal levels of vitamin D, you want your level to be around 50 nanograms per deciliter. That is where they see kind of an inflection point in terms of lowering risk for certain cancers, including breast cancer. It also is where kind of, again, inflammation tends to be less prevalent when you do have higher levels, 40 to 50, ideally 50. So if you're not in that 50 range, what can you do to raise your levels? So again, the first step in making sure your vitamin D levels are optimal is actually getting them checked. So vitamin D is not routinely checked by doctors. So you need to ask to have your vitamin D levels checked. It's not a part of, a standard panel. It is a separate lab test. So please make sure that you're asking your doctor at least a couple times a year to get your vitamin D levels checked. I personally am a proponent of getting vitamins and minerals through food or the environment if possible. While the recommended daily amount of vitamin D for 19 to 70-year-olds is 600 IUs and 800 IUs for anyone over 70, there are only a handful of foods that are rich in vitamin D. This includes cod liver oil, rainbow trout, sockeye salmon, and fortified milk. One of the best sources of vitamin D is sunlight. However, the recommendation for sunlight is not so straightforward. The amount of UV exposure needed to activate vitamin D in our skin depends on what season we're in, where we live, the amount of pollution in the air, how dark our skin color is, and the time of day that we're getting sun exposure. So some experts recommend somewhere between 5 to 30 minutes of sunlight exposure twice a week on our face, arms, legs, and back between the hours of 10 a.m. to 3 p.m. This is without sunscreen, which can, obviously cause sun damage or skin damage. So we want to make sure that we're speaking to our healthcare professional or dermatologist about our risks and our personal sunlight exposure recommendations, because everyone's different, genetics are different. So you just want to make sure that you're getting, what you need. If you prefer to avoid the sun and you struggle consistently to get enough vitamin D rich foods, supplementation may be your best option. And honestly, if people have low levels, supplementation is pretty much needed in order to get those levels up to optimal levels. So again, it's very important to speak to your qualified health professional about the appropriate supplementation dosage and schedule. Vitamin D is a fat-soluble vitamin, meaning that it stores readily in your body. Taking too much vitamin D increases your risk of developing hypercalcemia, which is a condition that weakens your bones. It can create kidney stones and interfere with your cardiovascular and nervous systems. That being said, appropriate vitamin D supplementation can safely increase your circulating vitamin D levels to optimal levels. So when you're looking at supplements, you will see both D2 and D3 available. At low to regular doses, there's really no difference between D2 and D3. D2 comes from plants, D3 comes from animals. At higher therapeutic doses, D3 is a better choice. D3 is more bioavailable, meaning it absorbs better in your body. And if you have rheumatoid arthritis or other joint conditions, you want to consider adding K2 or using a combined supplement like D3 K2. K2, vitamin K2, or otherwise known as MK7, is another fat soluble vitamin that has been shown to reduce inflammatory markers. However, there needs to be more kind of readily available studies on the effectiveness of vitamin K and inflammation. But vitamin K actually can help vitamin D be absorbed in your bones. So that's why they usually do pair it together. So today we focus on vitamin D, what it is, why it's associated with autoimmune diseases, and how you can increase your levels. If you would like more help managing your autoimmune disease or any inflammatory conditions, I would love to chat with you. I love helping people feel better by using both food and lifestyle. I think it's a really fantastic way to improve your health and avoid, potentially, adding on more and more medications as you kind of go along through your disease. So please reach out to me. You can book a free discovery call. It's in my YouTube profile link. I have also lots of downloadable content on my website, AnnieRubin.com. You can also follow me on Instagram and Facebook. And lastly, if you enjoyed this video, please hit the subscribe button. These do come out about every week, and I'm always trying to give you lots of information to help you live happily with your autoimmune disease. So thank you for joining me, and I will see you next time.